Welcome to My Trialist Trial Talk, Voices of Experience.
My name's Lonnie Van Horn. I'm 54 years old and I live in Indianapolis. I was visiting my general care physician because I was having some issues with urination and various things to do with that. And I went in and he said, "Oh, you must have a UTI." And he's like, sent me some antibiotics. And so I took some antibiotics. Then late summer of that year, I was just driving down the highway and I had so much pain in my lower extremities that I pulled into an urgent care. Nobody came to the counter, so I left and I drove straight to his office. And I said, "We have to do something. Something's wrong. Something's not right." And so he did then a physical exam on my prostate, found it to be irregular in shape, and sent me for a biopsy immediately. I had 10 samples taken, and 9 of them tested positive for prostate cancer. So he, at that point, and my tumor marker for prostate cancer is called PSA. And my PSA also came back at 685. And the normal range for that is 4 and below. So it was pretty evident that the cancer was metastatic right off the bat. I was diagnosed at stage 4 out of the gate, and that was in September of 2017.
How did you learn about clinical trials?
So the standard care of treatment for prostate cancer is Lupron, which is medical castration, basically. And that worked well for me for 6 or 7 months. On the 8th month, it stopped working, as it typically does with patients, from what I understand. And at that point, I became what they call castrate resistant. So my oncologist had presented or come to me with a clinical trial possibility. I needed to understand, how does this medication work? What does it do? He had already sent me for genomic testing at that point. So I knew the gene mutation issues that I had already. And so most of the conversation was him trying to drill it into my brain exactly what this medication would do based on my gene mutation. So he first explained the technical science part of it to me, which I wasn't all that understanding of. But then he kind of broke it down into layman's terms. This was a couple of hour conversation. It was a very long time.
How did you feel about clinical trials before enrolling in one?
In 2017, I feel like the prevalence of clinical trials wasn't as great as it is today. And there was a lot more stigma surrounding clinical trials back then as opposed to today. And the stigma being that you're a guinea pig or you are taking medication that, will make you grow a third eye or whatever. And so I was terrified, to be honest. And because I didn't know. And when we don't know something, we're terrified.
Why did you decide to enroll in a clinical trial?
I did all the research on each medication and looked at all of the side effects or possible side effects and, came to the conclusion that, the side effects were minimal, I believed, and tolerable. And so I inevitably said yes. I went for it because if I'm choosing not to do chemotherapy, my treatment options are pretty limited, and I knew that. So I chose to go with the clinical trial.
How did your family, friends, and community react when you told them you were enrolling in a clinical trial?
I think they trusted my judgment because I think, most people know me to be very detail oriented and, I do my research, I do my homework. If I don't understand something, I ask the questions again and again until I get it. So I think that everyone that knows me trusts my judgment and trusts that I have looked at every possible angle of every situation that might or can happen. So they were all very supportive.
Did you face any barriers when deciding to enroll in the trial?
They faced some financial barriers uh, with respect to pharmaceutical costs. The trial drug itself, the trial paid for, but the other drugs that I was already on, they didn't pay for. Like when I entered, this just seems crazy, but I entered the trial with already taking certain drugs, and then they added drugs. Well, they figured the drugs that I was already taking, they were not going to cover. Fine. So I did have some financial barriers on that. Uh, Luckily, I was able to get like some manufacturer's discounts and things like that. The other barrier was employment, because at the onset, before I decided to go on the clinical trial, and when the clinical trial nurse explained everything to me, not the oncologist, but the nurse who was in charge, I think that's what they call her. She explained to me that I might have some, it's, she called it a learning curve, but it's when you are, the way she described it was you're beginning to take medication and side effects may hit you all at once and they may be more severe and they will taper off as you continue going, if that makes sense. So she did say that there's a possibility that I could miss some time from work, um, which wasn't a horrible thing. But I did reach out to the HR department in my company and like explain them the situation, and they were generous enough to allow me to accommodate me and allow me to work from home when I needed to.
Can you tell us about your clinical trial experience?
My clinical trial was in phase 3. Once I started the trial, we were doing labs every 30 days to make sure that everything was still okay. And then we were doing scans every 90 days. And by scans, I mean a nuclear bone scan, which is daunting, and an upper CAT scan and a lower CAT scan. Trial medication was oral, and it was a combination of Lynparza, the brand name olaparib, mixed with abiraterone, which the brand name would be Zytiga, Dilupron, and quite a bit of prednisone.
How did you find support throughout the clinical trial process?
I was in a very unique position off the bat, right off the bat, where I did not have very much emotional support in my immediate home. Um, I'm married, I have a husband, and he does not want to talk about any of it. So I don't have that emotional support from him. Took me a while to get past that. However, I did. I was the winner. I did get past it and kind of accepted that. And so I immediately started doing things to get support from others. I did join Facebook groups. I had conversations with people in my situation. I ran out and found a therapist. Saw a therapist once a week. Best decision I've ever made. I have I made a couple of very good friends. They're very close. I'm very close to them, and I've been able to vent and cry and laugh and do dark humor about it. And whatever I need to do, they listen and they're there to support me. They don't ever offer any advice. They understand that, they just want to be there for me and with me. And so now, and it took me a while to get there, but now I do have a very strong support system on the emotional side for sure.
What was one thing you were surprised to learn about clinical trials that you didn't know?
The clinical trial nurse, or the nurse that was in charge of the clinical trial, I met with her every month. I met with her, and she was the nicest, sweetest lady. Her name was Marietta, and she was so helpful to me, because not only was she overseeing everything on the clinical trial, she was very detailed about, listening to my side effects, and she was very detailed about offering support or resources for things that I might have been struggling with. I didn't really have an issue with struggling with too much, but she was always offering the resources, that I could utilize if I was struggling with things. So I was very, very surprised about the just the support I received from this person alone. My oncologist was supportive too, but she really, with Marietta, I really developed a really insanely good relationship with her. And as you do that, the trust level is there, and just her empathizing with what I was going through, and I really wanted to clone her, to be honest. But I was very surprised by that. Yes, I didn't expect that at all, and it was just a wonderful feeling to have someone like that who really empathized and tried to understand everything that I was happening to me. To have someone that like that in my corner was just, it blew my mind.
What questions would you tell someone that is considering a clinical trial to ask their doctor?
In the spring of 2018, when we started talking about a clinical trial, what I struggled with was the layman's terms of the clinical trial, right? My oncologist wanted to sit down and read a case study to me. And it's like me looking on my chart, trying to read my scans. Like I'm just, it's crazy. So I would say for any patient to make sure that they understand in layman's terms what the trial does for them, will do, what the goals are from it, maybe the tenure, like how long is it going to last? Is it just 4 or 6 months, a year, or is it just indefinitely until you get booted off and don't meet the criteria anymore? Do you have to travel anywhere to get the trial? Do you have to increase your scans or labs? All of the things involved in that. So there are several questions that I didn't ask that I wish I would have. Not that I had any issues with those things, but information is power.
Why were you let go from the clinical trial?
Just was kicked off of it last year. But I was on it for almost 3.5 years. I responded to it very well. It did exactly what we had hoped it would do. So while I was on the trial, I didn't really have a need to think about, what's next, that kind of thing. What has transpired after the trial, I continue to take the trial drugs. I'm just not on the trial because the drugs started to stop working. And the trial has parameters, like you reach certain thresholds, that kind of thing, they boot you off. That's fine. We knew that was going to happen eventually. But after long conversations with my oncologist, we decided that we could get several more months out of the trial drugs before we had to make a decision on another treatment plan.
Was enrolling in a clinical trial the right decision for you?
Yes, and yes. Enrolling in a clinical trial was definitely the right decision for me. I would do it again in a heartbeat. I would do it 100 more times if I could. Um, and the moment that I realized that I had made the right decision was when my numbers started reversing. My tumor markers were going down, my PSA was going down, and we knew it was the trial drugs because the only thing that was happening prior to the trial was Lupron, and my PSA was skyrocketing. It was going up by 150 points per month. And so it was skyrocketing. And as soon as I was on the trial, I would say it probably took about 6 months before I actually believed that the trial was like really doing a good thing here. So that was kind of my aha moment for myself. Like, oh my gosh, this is amazing, and this is working, and this is doing exactly what we had hoped it to do.
What advice would you give someone who is having a hard time deciding to enroll in a clinical trial?
Reconcile the anxiety and the fear surrounding it. Reconcile it however you need to reconcile it. Um, I didn't do that necessarily. It took me a long time to do that, and it took me a hard road to do that. But reconciling those things is so important to be able to have the clarity of mind to move forward in anything like that. Um, so if someone has a hard time reconciling that on their own, find a friend, go talk to a therapist, go phone a friend, I don't know, whatever. Talk to somebody, uh, listen to podcasts, watch videos, like read something on it, like do whatever you have to do. But to settle that anxiety and fear just enough to be able to make an informed, logical decision, educated decision is everything. My mindset has shifted so much about clinical trials because, and I talk about this all the time to a lot of people. In 2017, when I was first put on a trial, I was there was a lot of stigmas, and one of them being, clinical trials are a last resort. Those are for people that are out of options, type of thing. And I view that completely different today. For me today, going through it, and yes, there were side effects, and yes, there were, I didn't feel good, and sometimes the side effects were tolerable, sometimes they were overwhelming. But for me today, as I sit here today, I see it as a part of a treatment instead of, as opposed to a last resort. And I encourage everyone to give these a look.